Suppose there is no picture in the exam. In this case, how to diagnose it? The moment you do a surgery, open up the ovary, what you see? You see this tumor is cystic, completely replacing the ovary. You can see tooth, you can see hair, and you can see yellow paste-like material. The moment you cut, you can see something is coming out almost like a toothpaste, yellow in color. And this is what we see in a dermoid cyst ovary. And the paste-like sebum is nothing but a keratin. Microscopically, you can see anything you like to see. Anything you like to see in human body. Like you can see the skin, you can see the hair, you can see the cartilage, you can see the bone, you can see the thyroid tissue, all this blah blah blah. When I was a student in medicine, we had a kind of practice. You can call it a game. Whenever we used to see a teratoma on the gross examination, it was a kind of competition between us who can find most tissues of different types, and those who gets the most amount of tissue wins. Is a play. You can play with that in this case also. So remember this thing, that this can show anything you want, but all are mature content. All can be mature like a normal human tissue. Sometime, however, some dermoid cysts contain one particular tissue than any other tissues. In those situations, we can give a name. For example, some dermoid cysts contain excess amount of functional thyroid tissue. Thyroid follicles. Functioning thyroid follicle. It means that it is producing thyroxine. In this scenario, the patient should present with a thyrotoxicosis, which is known as struma ovary. Struma ovary. Struma is meaning, what is the meaning of struma? Means thyroid. So it is ovarian thyroid tissue. So please remember, this is a kind of dermoid cyst. The only difference from the rest of the dermoid is that it has got a huge amount of functional thyroid tissue. This is how it looked like. You can see the big picture. I am trying to make it bigger. You can appreciate the big cystic appearance of the tumor. You can see this big ball-like structure with a lot of hair inside. And probably if you can do some Google search, you can see the tooth-like structures. So question is that which tumor of the ovary contains hair and tooth-like structure? What is the answer? The answer is benign cystic teratoma or mature teratoma or dermoid cyst. Now why it is called dermoid cyst? Because this tumor has got a huge amount of squamous epithelial component or the skin. Technically, this cyst is lined by the squamous epithelium or the skin-like structures. Since you can see huge amount of skin material, we can call it a dermoid cyst. Now these are the various structures we can see here. If you look at the picture, you can see the adipose tissues. We can see some epithelium of the respiratory tract. We can see some mucosal glands. We can see some hyaline cartilages here. You can see some serous glands are peeping through it. This area looks like a neural tissues. So basically they contains lot of immature tissues. You can see cyst, tooth and hairs, which is a dermoid cyst. You got it right? Here it comes to the dysgerminoma. As I told you, this tumor has got a similar tumor in the testis which is known as seminoma. This tumor arises with a gonadal dysgenesis. It is always malignant. It is always solid in appearance. Never forget that this tumor is extremely radiosensitive. And this is something good news for the patient. It means if we have a dysgerminoma and if we do some radiotherapy, 80% people may show the cure. It is unilateral and microscopically similar to the seminoma. So this is how it look like. First I want you to see the gross appearance. You can see the tumor is very solid, replacing the entire ovary. No ovarian tissue is left. How solid, a little bit of tan yellow in color. If you look at the microscopy now, there is something that you must never ever forget in your entire life. You can see the cells which are very small and round with a prominent nucleus. Some nucleus may show some nucleolus. We can see huge amount of fibrous stroma that has got a lot of lymphocyte that suggests a good prognosis.